Afternoon to everyone. Excuse me, I just lost my voice for a moment there. So good afternoon. Can everyone see our welcome slide? Outstanding, outstanding. So the essence of time, I'd like to be able to move through our slide deck here and our presentations. So we are talking about social distancing does not mean social isolation. So we're trying to demonstrate here today that we are here for you. Shortly, you'll be able to see me. I am Dr. Veronica Carey. I'm the Assistant Dean for Diversity, Equity, and Inclusion. But I wanted to share some information for you before we get started. This is brought to you by the Board of Diversity, Equity, and Inclusion and the Counseling and Family Therapy Department of CNHP. So just in terms of our netiquette for today, so we know how to proceed, excuse me, all participants are muted by the host, so that we would love to see your shining faces though. So I have that kind of on number 4, but if you feel like you want to, be a part of our gallery grid there, don't hesitate. There is a chat feature at the bottom lower section of your screen. So if you come across any questions for any of our panelists, either of our panelists today, don't hesitate to bring those questions to the chat feature, which I will be monitoring. The moderator will ask as many questions as possible from what you guys are sharing through the chat space. And for those of you that might have joined earlier, you're now hearing that this session is being recorded. So what I want to be able to offer for you now is an illustration of what our dean has brought to light. She has shared a couple of very interesting emails with us. So I wanted to make sure that you could hear what she'd like for us to know from her standpoint. She said that Drexel University and the College of Nursing and Health Professions is committed to assuring the safety and well-being of our students, faculty, and staff, as well as providing continuity and excellence in our education, research, and clinical missions. She's talking about this in terms of regardless of your particular disciplinary view, focus in the College of Nursing and Health Professions. Of course, this is Dr. Gitlin speaking. She wants to personally congratulate each of you for choosing to pursue noble and professional careers in healthcare. As you are experiencing firsthand, the COVID-19 pandemic is a call to action. The world needs and awaits your knowledge and skills, and we are here to ensure that you will be fully prepared to do so. And this is why we are engaging in that online format. So why are we here today? What is the purpose of us getting together? So we want to be able to move you forward. We want to be able to address the fact that this can be a very stressful time, an anxiety-laden time. It's filled with a lot of uncertainty. And most certainly, there are no historians to go back to and say, how did you all survive the quarantine of 2000, for example? This is a history-making event around the world. So we're here to support you. We're here to guide you. You're going to hear from 2 very competent panelists that can respond to your academic needs as we move you forward. So that's why we are here today. Actually, right before I got on this presentation, I got a message from our dean, and she says that she wants me to make sure to note that in each one of our classrooms, it's very unprecedented that all of our courses are going to be online in the same quarter. So that therefore, each one of the faculty will be offering frequent wellness check-ins during your quarter. Whether it looks like just how are you all doing at the start of a class, or whether it be some sort of research articles for you to read and have more information about how to do well in the absence of being face-to-face. But we're very cognizant of the fact that we're going to have to probably institute some unprecedented support mechanisms in order to guide everyone through this process. One of the things that you will be able to use, and there's a lot of information on the screen, and I'm going to bring this up excuse me, a second time during the presentation towards the end, but the Drexel Counseling Center is also available to you. You can make appointments via the email that you see here or the phone number that is here. especially if you feel as if you need support beyond the faculty check-ins. There will be virtual support groups and workshops, and also for individuals who feel as if they are students in recovery or those looking for additional supports for alcohol and/or drug concerns, you can take advantage of the Havens virtual meeting program. And again, this is going to be recorded, so I can always send it back to you via email in case you aren't able to, of course, copy these things down very quickly. And as always, there's a therapist available off hours, in other words, 24 hours at the emergency line, which is also illustrated below. So what I'd like to be able to do now is get into the introductions of our presenters. I'm going to allow them to share the overview of their presentations as well as any credentials that they would like to share. I am Dr. Veronica Carey, as I had mentioned earlier. And let me see if I can navigate this stop share at this moment so you can see me. So excellent. So I am the Assistant Dean for Diversity, Equity, and Inclusion at Drexel University. And I am also an Associate Clinical Professor within the College of Counseling and Family Therapy Department. So I'll be moderating today's event. And I'd like to turn it over now to Dr. Ebony White, who is also in the College Counseling and Family Therapy Department in the College of CNHP. Dr. White.
Good afternoon, everybody. As Dr. Carey stated, my name is Dr. Ebony White. I am an assistant clinical professor in the Counseling and Family Therapy Department. I'm also the program director for the Masters in Addictions program that is online. And I'm just here to support all of you in your questions today. I know that, teaching in the undergraduate program, I recognize that there are some fears, some concerns, some worries, some stress that students have been presenting with. I've had students reach out to me through email in regards to how to transition from face-to-face classes to online classes. They're worried about navigating the technology, navigating the online space, just various questions. And so today I'm just going to probably focus around anxiety, issues that may come, how to handle anxiety, how to manage it, maybe some strategies and tips to help you navigate. And I always like to say when people ask me about anxiety that anxiety is also positive, right? And so there is a such thing as a healthy amount of anxiety. It helps us stay motivated to complete tasks, to get things done, to make sure we don't forget anything. And so, that is a normal amount of anxiety, but when anxiety starts to get the best of you and interfere with you completing tasks or interfere with your relationships, that's when you want to do kind of a self-check and maybe get some more support. But like I said, I'm here to answer all of your questions today. I don't want to take up too much time. There is another expert on the panel today, Dr. Ewing, and I'm sure that she's going to be super resourceful as well. Thank you for your time today.
Hi, everybody. I'm Dr. Stephanie Ewing. I am a licensed clinical psychologist with a specialization in developmental psychology. And I am an assistant professor also in the Counseling and Family Therapy Department. I teach graduate students a lot of the time, master's students and those pursuing doctorate degrees. And as a clinical psychologist with a specialization in developmental, I'm really acutely aware of the kind of different life phases that students may be in right now and what you may be facing. If you're undergraduates, as Dr. White said, you've got probably one set of issues that you're contending with. Maybe you're back home with your parents and trying to navigate that while also taking online classes. And some of you also might be at different life stages. And I know that's true for graduate students as well. And so I really want to be able to speak to that today, how to balance kind of all of these competing demands in this really unprecedented time. I know for myself and my own family members, everybody's experiencing a lot of really difficult emotions right now. And so talking about kind of the fear and the grief and the anger maybe that people are experiencing and how to kind of traverse through that and support each other during these times.
Outstanding. Thank you both for those overviews. I really appreciate that. So let me just talk about in terms of some things that your panelists had shared prior to, or actually in preparation for today's meeting. So we're living through unprecedented events, as both of them have kind of acknowledged. I think all three of us have acknowledged that, and everyone on the call realizes that. The scale of which most of us have never witnessed in our lifetimes. It is frightening. It can be frustrating. It can also be sad. And yet at CNHP, we are all somehow trained and involved in healthcare related fields. So we continue to teach, learn, and survive and serve in those fields in the midst of what we call now our current reality. So I think we should think about coming together to think and discuss ways that we can try to help others and to look at those things in terms of how we're going to work with it, how we're going to live with this, and how we're going to care through these difficult times. So Dr. Ewing, let me ask you then, so what can we do to support ourselves and others during this time?
So I think there are a number of things that can be really helpful, but the one that I want to focus on the most, because I think, we're all getting bombarded, I think, with lots of tips for how to stay productive and, in terms of things like meditation and mindfulness, and there's lots of other different techniques that we can talk about, and I want to talk about those things too. But I think the number one thing that I think is really important is relationships. And I say that, and I want you to think of maybe a little bit differently about it than at least I've been reading about in the media a lot of the time. It's not necessarily about the quantity of relationships. I feel like I've seen people, reaching out in lots of different ways and trying to connect with a lot of different people. For me, I think what's most important is the quality of the relationships that you're connecting in and the quality of the connection. I think during this time, it's really easy for everyone to feel disconnected and isolated and potentially uncared for because we're so distant from each other. And again, everybody's circumstances are different. You may be home with your parents. You may be trying to homeschool kids while also take care of aging parents and kind of being in the sandwich generation. I know there's graduates in that position while also trying to learn online. And so for me, it's really what I'm, working with some of my clients that I do teletherapy with. It's about the quality and the depth of the relationships. This may be a time to really focus on improving kind of communication with your loved ones and feelings of closeness with loved ones. And I think that can help. So working on those areas.
Excellent, excellent. And whatever you had shared just now sparked Sarah H. and Lisa to share. And Sarah shared that there is an app called Headspace. So for those of you that may be unfamiliar, there's a resource for you. So we're already building community on this call, so I'm excited by that. And then Lisa also shared there is another app, a yoga app called Down Dog. I don't know if it's Downward Dog or just Down Dog. I think she shared it's Down Dog. And that's available free until May 1st. So yes, keep your chat, comments, and issues coming, because I'm monitoring that as we go along. Something else that was prepared in preparation for today's call is that a lot of loss has occurred during the COVID-19 pandemic. I think we can all agree that, and it may be even someone who you know or someone that you know has COVID-19. The loss of life and threat to life has resulted in other losses, including social engagement, physical contact, and a disruption to school, work, home. So adjusting to this way of life can be difficult and may result in experiencing symptoms associated with anxiety and stress. So it's going to be important to know these signs. And I think we might want to pause and kind of bring in Dr. Ebony to sort of address, how do I know when my anxiety exceeds a normal level?
Absolutely. So first I want to address your first statement in regards to loss. A lot of times when we talk about loss, we talk about it in terms of grief and loss, when it's really loss and grief. The grief typically comes after the loss has occurred. And I've had a lot of students reaching out to me not a lot. I had some students reaching out to me in regards to sadness around not having a graduation or events that they were preparing for, and how if I can be candid, it sucks to, look forward to something over 4 or 5 years of your experience and not be able to do that. They were looking forward to having celebrations that are likely going to be canceled or at minimum postponed. You talked about there has been a loss of life and people getting sick. And more importantly, to Dr. Ewing's point, there seems to have been a loss of connection, particularly that physical connection. And so this I'll say social distancing, even though we mean physical distancing, has really resulted in, or the pandemic has resulted in this physical distancing that has people experiencing signs associated with the grieving process. And so I want to first encourage students that if you're feeling angry, if you're feeling sad, if you are struggling with accepting all the changes that has happened, that's completely normal. And those emotions are absolutely valid. And to answer the question that was posed, I kind of alluded to it in my introduction, that when anxiety gets to the point where it's interfering with daily tasks. So if, you're so worried, or you're having, your thoughts are being interfered with, but you can't be productive, or you are struggling to maintain your grooming routine, or you notice that you're becoming irritable when talking to people, right? So those are signs that your anxiety has escalated and that you would need more support. And so it's normal that you have some anxiety and some stress because of what's going on. But when you notice a change in your behavior, a change in your thinking pattern, that your mood is constantly or consistently low, then I would encourage you to seek further support and further assistance. And I know Dr. Ewing, said that you're probably inundated with tips, but of course I'm gonna offer a tip because I find it useful for my clients. But a lot of times people don't pay attention to the physiological symptoms associated with anxiety. So the heat or sweaty palms, elevated heart rate, things of that nature. And so just to get stable, of course, deep breathing is a great tip, but I like to use something called Tip Skills. And I'll make sure I put it in the chat box, but it's TIPP, just to help you remember it. And that's temperature, increased activity, paced breathing, and progressive muscle relaxation. And you don't have to do all 4. You can just, choose one, but putting ice cubes in your hand, or putting a warm cloth on your head or on your neck, right? And so that would be temperature. And that just helps you to regulate those physiological symptoms. For 60 seconds doing jumping jacks or push-ups, just something that gets the heart rate going. Paced breathing, so just focusing on your breathing in and out, breathing in for 2 seconds, out for 4 seconds, because it gives your mind time to focus on something. And that really helps when you're having, when your thoughts are kind of scattered. It helps to bring it in because you're focused on something. And then progressive muscle relaxation. We hold a lot of tension in our bodies. And so I just recommend tightening different parts of your body for a certain amount of time and then letting it go, and trying to do that over and over again until you realize that those symptoms have kind of alleviated to some extent.
Yeah.
Excellent. Oh, go ahead.
I wanted to just add, so there are some, I see in the chat box, several apps that people are suggesting, as Dr. Carey mentioned, and there are some good progressive muscle relaxation, guided progressive muscle relaxation videos on YouTube. I've seen a lot of those. So all of these things, I think you can get guidance with, either from a therapist if you're going to do teletherapy, or on your own if you're comfortable with that. Again, just going online and finding some of these apps and videos. I think the other thing I wanted to say is that it's really normal right now to have bad days, where maybe you're feeling really more anxious than typical for a day, or more sad than typical for today. We're hearing bad news every day, and we're all going through a grief together. We're grieving kind of like the loss of so many things, not just school related things, but some of you may know actual people who are affected right now by this disease. And we're hearing about a lot of loss. So it's completely normal to have bad days, and to just be just be graceful with yourself, just being yourself, giving others grace, trying to be as patient and forgiving as possible, both with.
Excellent. And actually, you can stay on, Dr. Ewing, because I was going to ask you about your teletherapy. It may not be as familiar to most students as you might think. Can you give us an overview on how students may be benefiting from that at this point?
Sure, yeah. So I have several graduate students who are not in my program, but from other universities who have started teletherapy with me. A lot of therapists have profiles on Psychology Today, and this is all different types of therapists. They don't have to be psychologists. So there's marriage and family therapists, there's licensed professional counselors, I think there's psychiatrists on there as well. So you can go on the Psychology Today platform to look for therapists. If you're not going to use Drexel's teletherapy, Drexel has really good teletherapy available to Drexel students. So I would try that approach first. But another option, again, is to go and look on Psychology Today and see which therapists are taking new teletherapy patients, and also if they have sliding scales. I know I use a sliding scale for clients that I work with, particularly students who right now might also be feeling a lot of financial pressure. I was not used to that platform as a therapist, but I've actually found that it works really well. Almost as, it's almost, I feel like the connection through teletherapy is almost as good as in person, if not as good. And I do think a lot of clients are telling me that they're getting a lot out of it. So again, if you're someone who feels like you're experiencing more anxiety than you feel comfortable feeling right now, and you want some help with that, or depression, or any other, or you just want some help with coping and problem solving skills, I think that's always a really good option.
Excellent. Thank you for sharing that. And Delara had shared also about social distancing as opposed to social isolation, which is now being adopted by the World Health Organization, so WHO. She shared that it is physical distancing in place of social distancing, and recognizes that we are social beings and how important it is to maintain those kinds of connections. So thank you, Delara, for actually sharing that as well. We have a colleague, Dr. Roberta Waite at College of Nursing and Health Professions, who also has shared that we should probably limit or delimit our social distancing kinds of dialogue and talk more about physical distancing. And that's why, as a part of our title, we had to allude to the fact it does not mean social isolation, and that we are definitely here for you. So I appreciate that. Dr. White, thank you for putting in those tips there so people can jot that down while they're on as well. One thing I will share too, my teaching, quote unquote, expertise is in psychiatric rehabilitation. One of the things that is very important to recognize is, how do we remain vertical? How do we live our lives throughout the day? When I teach those sections of psychiatric rehabilitation to students, I tell them that we live our lives vertically, up and down. When we're not well, we go horizontal, right? Something is not going well in our lives, and all of a sudden that one resource in our house, our bedroom, becomes very important to us. And we want to lay in that one resource in that room, our beds, and stay there for a while. So if we find that, like Dr. White had noted, if you find that that's where you're headed a lot, or you don't want to come out, or you're not as social as you used to be, texting or even on social media, the ways that you stay vertical are skills, meaning that you're able to do something effectively, not perfectly, just effectively, to get through your day. You have resources, so it could be something like social media or your computer or your cell phone. And then you have what's called supports. And supports are things that you're more emotionally connected to. So there could be a family member, a friend, a peer. It could be your animals, your plants in your house, something that you really do have emotionally connections to that get you through the day. Because ultimately the goal is to function. You want to be able to get from one day to the next day. I always tell students, not every classroom, every course rather, are you going to get an A? The goal is to pass that class and get on to the next one. And I guarantee you, if you keep that in the forefront, you'll be heading towards graduation before you know it. So now that I'm talking about graduation a little bit, Dr. Ewing, and Dr. White, actually, I'm sorry, maybe you could talk a little bit about the balance sort of between what's the academic sort of progress with other areas of your life? How do you find that balance? I sort of gave a construct with skills, I can do something effectively, resources, I can use something to help me function, or I can call out to a support when I need one. But what might you recommend to find a balance within all of that?
Thank you. I want to, Dr. Ewing, she said a lot of really important things, but something that she said that is super true is that we're all individuals. We're all very different. And so I can tell you what has worked for me. Task list is something that worked for me, but you want to also make sure that you are doing exactly what Dr. Carey said, that you're not trying to be perfect, but that you're trying to get things, the goal is to get things done. And so in regards to academics, a lot of you are going to now be sitting in front of a computer for a really long time on certain days. And so you want to make sure you're taking breaks. And you want to make sure that you are at least daily connecting with someone, whether that's someone in the house or someone on the phone. FaceTime, and I don't know what it's called on Android, maybe people use WhatsApp to do video chats, but having that connection daily so that you can feel connected on a regular basis is really important. But you don't want your whole day to just be focused on academics, and you also don't want to go a day without at least checking into your academics as well, right? And so it's important for you to be able to find that balance. And I just wanted to add something to what Dr. Carey said in regards to, I think it was skills. Even though we can't go to public places, it is okay to go outside and get some fresh air, to, maybe walk around your block, to garden in your backyard or whatever it is that you do. You want to make sure that you're getting some sunlight because it's good for your overall well-being. And so that's an added skill that you can include too.
All right, excellent, excellent. So, Dr. Ewing, is there anything in terms of, I see we're coming up on our half an hour, and for students to know, we purposely made it for 30 minutes because we wanted to see, the flow of this, how many questions may come to us, and we can always come back in a couple of weeks, maybe about the third week, we might do a check-in to kind of see even how faculty are doing and how students are doing together. It may be interesting to do a faculty and student check-in at that point. And I'll talk to Dr. White and Dr. Ewing about that potential, again, to support everyone. But is there anything lastly that you want to offer, Dr. Ewing, before we begin to summarize?
So I just, two things I thought of as Dr. White was talking. So your focus on everybody as an individual. So what the resilience research tells us, and right now we're all being called on to be resilient, is that it's about being adaptive. So this is, again, a time where we don't know necessarily what's coming down the pipeline all the time. We're being surprised pretty constantly with new news. And again, just being patient with yourself and others, and in order to be as adaptive as possible to what you're faced with, and just kind of trying to remain centered as much as possible, using some of the skills that we've all talked about and some of you have recommended, to try to, just stay centered and adapt to each day and taking it each day. The other thing I wanted to say in terms of social connection is your classes can be a forum for that. So as Dr. Carey mentioned in the beginning, your professors hopefully are going to do a check-in with you. That's what they're being advised to do, and using your classes as a platform for social connection and not just academic pressure.
Excellent. So then just allow me then to take a minute before I give you sort of our last literal couple of slides, and I had promised to put those Bexel counseling resources back up there for you. But just in terms of some tips that you've heard today, or even just some information that you received today. So we talked about relationships and being mindful that it's so important to stay connected. And I want to thank Delara for sharing that it's not social distancing, it's physical distancing. So we need to be mindful of the fact of how recently have I reconnected or connected with someone. I mean, I found that I reach out to persons I haven't talked to in a while to say, I only pull them out during my Christmas card list, right? So I'm contacting with, connecting with people that I haven't maybe, I might only talk to once or twice a year. Teletherapy as being an actual resource. We talked about loss and sadness, and we're not negating that those things are transpiring now. So we need to look at, and Dr. White, if I'm not mistaken, even talked about loss of celebrations. So you might have had a mindset as to what might have transpired for yourself at the end of the spring quarter and what that might look like for you. We talked about the validity to your thoughts and your feelings. So again, we're acknowledging that we understand that these things are actually difficult. We also mentioned about, I had talked about how we remain functional in the community. So be thinking about, you know, your skill set, what resources will you have in place for yourself? So that, for example, if you're anxious about being online because you think that maybe your connections might go out for your internet or something like that, what other resource can you begin to put in place? Today's Friday. You could be thinking about that until Monday. And then what supports you have in your life. So when you want to take that laptop and throw it across the room, who can you instead talk about? I mean, we each have terminal degrees, and I don't think anyone has gone through it in a linear fashion. So there were those moments when we had to call on supportive people. We also talked about the TIPP that Dr. White shared, and you have that in the chat illustrated there for you. I believe that Alexandria has also shared, she asked a question, are there any resources for nutrition and eating healthy during this time? So you know what, Alexandria, that's a great question, and I can respond to that. I'm going to throw up my email for you at the end. If you can put that in the email, I can most certainly get you directly connected with our nutrition department, and quite possibly you might even have that as a person who can respond to those issues on our 3-week check-in type of a thing. We talked about individualism and how that's very, very important. And then lastly, I think it makes sense to kind of close with the fact that we need to be mindful of patience. I think patience is going to be very, very important during this time as well. So let me see if I can get us back to our sharing. Are you seeing the slides at this point? Kind of, are you able to see this last slide?
No, the slides aren't being shared.
Dr. Carey, I see a specific question from Sarah.
Okay.
Who I believe she's saying that she's working right now as an ICU RN, and also juggling student life and self-care. And I just wanted to make sure to address that, because Sarah, I don't know if you can chat the answer to this, but are you currently working in the ICU as a nurse as part of your program? I don't know if she's up. There we go. So that's.
She said, yes, I am.
Yeah, so that's something that we have not really even touched on. I didn't realize, Dr. Carey, maybe this is just my oversight, that our nursing students were still in rotation. So, that's thank you so much for that work right now. You all are doing such an amazing service in the course of your learning right now. So, and in the course of your life as students. And so I just big thank you to you, and just how much you're appreciated. But that's a whole other level of stress. I know I have several family members who are emergency room doctors right now, and the amount of stress that you all are carrying is really quite inconceivable, I think, to those of us who are not in that position. So, so I think I just was reading your comment there, and I think, reaching out and trying to stay in touch with your advisors as much as possible for any recommendations that they have. And I would really recommend, if you're feeling overwhelmed, which I'm sure you are, I know in Philadelphia, there's a free mental health platform being set up where mental health providers are donating time for teletherapy for first responders and those who are working in the medical field right now. I will try to look that up and send it to Dr. Carey so she can send it out to folks as well. But just trying to get support, even though I know you probably don't have a lot of time right now, but it's really important to pay attention to self-care as much as you can. And thank you again so much for the work that you're doing.
No, absolutely. Thank you. I will definitely second that. So unfortunately, I'm not able to, for some reason, to throw up that last slide again, which illustrates, but I will give you my my email, and actually Dr. Ewing or Dr. White, if you could type in my VDC22 at Drexel in the chat for me while I'm kind of closing for us. I don't know why my screen won't share. I can see it, but for some reason I'm not able to put it back up there again, which is one of my hesitancies, talk about anxiety before the presentation. So it sounds as if we made really good use of time. If anyone wants to see the Drexel Counseling Center's resources again, please do not hesitate to email me. I will be able, and I can even send you back the entire PowerPoint presentation. This again was recorded. We're going to be able to have it up on our Drexel YouTube channel. So once we submit this back to our marketing and communications department, I cannot thank Dr. Ewing and Dr. Stephanie Ewing and Dr. Ebony White enough for availing yourselves today. Your expertise was most certainly justified and warranted. You touched areas that I think our student listeners really benefited from. And also, when you email me, if there's any other ideas of what you want us to dialogue back about when we come back in a couple of weeks, please don't hesitate to let us know. We want to make this as user-friendly as possible. So again, this is Friday. Your classes start on Monday. As Drexel says, ambition can't wait. So we're hoping that we're going to be able to support you during this time. All right, so take care, enjoy yourselves, do something for yourselves over the weekend, and we'll see you all Monday. Take care.
Stay safe, everybody.
Bye. Bye. Thank you, everybody.